Nursing turnover is a safety issue that is impacting many hospitals. Turnover can lead to an inability to provide quality care. This presentation will examine nursing turnover, explain its effects on patients, nursing, and the organization. We will also explore innovative solutions, which will be discussed to retain an experienced workforce and improve quality patient care. Nursing turnover also impacts quality care. Nursing units are working with less staff, inexperienced staff, or temporary staff, which is putting our patients at risk. Nurses have a limited amount of time to spend with each patient, and these time constraints are limiting their ability to meet all of the patient's care needs. Organizations are also hiring novice nurses to fill vacancies, but they are not adequately trained to provide the care that the patient needs. High turnover has also led to heavier workloads. Several studies have linked high turnover with an increase in medication errors, falls, and adverse events. Nurses are also impacted by turnover. The high demands can affect the nurse's mental health, leading to increased stress and a decreased level of job satisfaction. Turnover is an ongoing problem at my organization and is currently being measured on a rolling 12-month period. The current voluntary turnover rate is 13.5%, with an organizational goal of 11.3%. The line graph shows turnover rates for the past 24 months. In March of 2015, organizational turnover was at 11.6%, but is currently at 13.5%. The rise in turnover is an indication that our current solutions to curbing it are ineffective. We must use creative ideas to change these numbers. The national average is 14% for bedside nurses and almost double that for nurses in their first year of employment. Turnover can also have a significant financial impact on organizations. The majority of turnover costs are related to onboarding. Organizations must hire new staff to replace those who are leaving. It is astounding that $65,000 per nurse is the cost of turnover at my organization. The graph to the right shows the significant financial impact of turnover. These numbers are astounding. These numbers do not also include cost with using temporary nurses or overtime to cover shortages. Some of the current solutions at my organization are nurse residency programs, which provide support for nurses during their first year of practice. There are also creative scheduling solutions. We utilize a self-scheduling model that considers the staff preferences to promote work-life balance. Overtime is also an incentive. However, this can contribute to burnout. Temporary nurses are used, but they only cover the short-term needs, but are not a long-term solution. What can an organization do to unlock the door to quality? The current efforts to decrease turnover are not working. Organizations must come up with innovative solutions to retain our current workforce. Using innovation can help adapt to an ever-changing environment and an effective use of available resources. How can we be innovative? Organizations must shift the focus to what is important for the patient and the nurse. Two innovative solutions to turnover that have been shown to be effective are resiliency programs to help nurses cope with a complex, changing environment and to reduce nurse-patient ratios. Nurses must address the physical, mental, and emotional needs of patients, but how can they do this if they do not have enough time to spend with the patient? Reduced nurse-patient staffing ratios should provide help for the nurse to be able to meet the needs of the patient. How can resiliency programs help with nurse turnover? First, let's talk about what is resilience. Resilience is the ability to cope successfully despite adverse circumstances. This can be difficult in today's environment where nurses are stressed, the demands of the patients are higher, and nurses are still expected to provide quality care despite the increased workload. The benefits of resiliency programs include improved quality of life, promoting better health, and better coping strategies for nursing staff. Some of the reasons noted for turnover are high stress due to workload and acuity, understaffing, which can all contribute to burnout and lower job satisfaction. How can resiliency programs help? These programs show nurses that the organization cares about their well-being. These programs focus on behavioral health and wellness. It equips the nurse with tools to effectively manage stress and emphasizes the importance of self-care. It also gives the nurse the support they need to function in a chaotic environment. Okay. First, let's talk about resilience. What is resilience? Resilience is an ability to cope successfully despite adverse circumstances. This can be difficult in today's healthcare environment where nurses are stressed, the demands of the patients are high, and nurses are still expected to provide quality care despite the increased workload. Some of the benefits of resilience are improved quality of life, promoting better health, and better coping strategies for nurses to deal with the chaotic environment. Some of the reasons noted for turnover are high stress due to workload and acuity, understaffing. Both of these can contribute to burnout and lead to decreased job satisfaction. How can resiliency programs help? Resiliency programs show nurses that the organization cares about their well-being. These programs focus on behavioral health and wellness. They equip nurses with tools to effectively manage stress, and they emphasize the importance of self-care. This gives the nurse the support that they need to function in a chaotic environment. Why aren't their current interventions working? Current interventions are focusing on how to meet the patient's needs, but little attention is being given to the physical and mental well-being of the nurse. The current interventions are not working, partly because nurses do not feel supported or cared for as a result of the current interventions. The current process is meeting the needs of the patient, but not the needs of the nurse. Our turnover rates are continuing to rise. Organizations must be more aware of what the nurse needs. Resiliency programs have been implemented at other organizations and has shown promising results. Programs have led to decreased stress and anxiety and an increased focus on self-care, improved coping strategies, and has also been linked to increased job satisfaction and retention. Nurses who work in a healthy work environment are more satisfied and less likely to leave. Another innovative approach to decreasing turnover is adequate nurse-patient ratios. Today's healthcare environment is driven by value. The focus is on providing quality care and a positive patient experience. This type of system requires nurses to have enough time to spend with each patient to meet their needs. High nurse-patient ratios prevent the nurse from doing this. Inadequate staffing can also have financial implications for organizations. Medicare links reimbursement to quality of care. Organizations will not be reimbursed by Medicare for patients who have preventable complications. There are also patient safety concerns related to increased workloads. Bedside rationing may occur. Nurses will provide the care that is essential, but often may omit some care due to lack of time. Literature reviews showed a link between patient deaths and heavy workloads. One study in Pennsylvania showed that 4,535 patients out of 232,842 died within 30 days of hospitalization. Some of these deaths may have been prevented with adequate nurse-patient ratios. The current interventions being used at my organization do not fix the problem, but only provide temporary solutions. Increased overtime is an incentive for staff to work more, but it can also lead to burnout. The use of travel nurses costs additional money. These nurses are not familiar with the unit culture, policies, and procedures. This can contribute to adverse outcomes for our patients and lead to higher stress for nurses as they need to spend time helping the traveler. Experienced nurses are also being replaced with novice nurses who do not have the skills to meet complex patients' needs. These temporary solutions are putting our patients at risk. Current interventions are also leading to job strain. Nurses are overworked, which leads to burnout. Additional stressors can compromise patient safety since the nurse may not be as focused on the patient. Job strain can also lead to physical and psychological problems that are associated with turnover. Organizations must look for a long-term solution that focuses on quality patient care, but also the well-being of nurses. Manageable nurse-patient ratios allow the nurse to spend more time with the patient, which results in less omissions of care. The increased time has been shown to decrease falls, pressure ulcers, and errors in care. Staff are also more satisfied. They have more time to spend with the patient. The American Nurses Association Code of Ethics guides the nursing profession. Nurses are obligated that their primary commitment is to the patient. Nurses must also be advocates for their patient and promote patient safety. This can only happen in an environment with lower nurse-patient ratios. Nurses must also be servant leaders and do what is right for the patient. They cannot do this without adequate time to provide care. Biblical teaching should also guide organizations to do what is best for the patient and nurses. Philippians 2:4 teaches Christian leaders to look out for the interest of others. Organizations can do this by implementing measures that lead to quality patient care, such as decreased nurse-patient ratios. Nurse leaders have a moral and ethical duty to lead by example. They can do this by motivating staff to accept the change. Nurse leaders must be active participants in the process. They must provide adequate information about the change and communicate clear expectations to staff and their role with implementing the change. Nurse leaders must also assess and monitor the change to make sure that it is effective. The leader can look at turnover rates since the change was implemented. They can also look at staff satisfaction surveys to see if there were improvements since the change. It is also important to look at patient satisfaction results. Value-based care is doing what is best for the patient. Leaders can also look at adverse events and note changes since the nurse-patient ratio was decreased. The most important job of the nurse leader is to lead by example. They must embrace the change and provide support and encouragement to the team. Change cannot be effective unless there is supportive leadership available. In conclusion, innovation is needed to improve our current processes. Nurse resiliency programs and decreased nurse-patient ratios are innovative ways to decrease turnover. These solutions provide support to nurses and allow adequate time to care for their patients. Change will only be effective with a leader who is committed to the patient, staff, and the organization. The nurse leader can motivate staff by leading by example. Change is inevitable, but healthcare leaders can be an example in order to successfully implement the change.